Hi everyone, I'm Dr. Nicole Nemeth, board certified plastic surgeon. I'd like to speak a little bit about how we at Plastic Surgery of Westchester ensure your safety during surgery. One of the most important parts of any surgery is safety, and before we focus on aesthetics or technique, we focus on risk reduction and patient protection at every stage. Safety begins long before the day of surgery. Every patient undergoes a detailed medical evaluation, including a full health history, medication review, and necessary lab work. When indicated, we also require medical clearance from a primary care physician or specialist. If something increases risk, we address it first or we postpone surgery. On the day of surgery, we follow strict sterile protocols. The surgical site is carefully prepared with antiseptic solution and all instruments are sterilized according to accredited standards. Anesthesia is administered and monitored by a board-certified anesthesia provider. Throughout the procedure, your heart rate, blood pressure, oxygen levels, and ventilation are continuously monitored. To reduce the risk of blood clots, we use sequential compression devices during surgery and encourage early walking after the procedure. In appropriate patients, we may also use additional preventative measures based on individual risk factors. During surgery, meticulous hemostasis, meaning careful control of bleeding, is maintained at all times. We work methodically and avoid unnecessary trauma to surrounding tissues. When appropriate, drains are placed to prevent fluid accumulation. Internal suturing techniques are used to reduce dead space and tension, which lowers complication rates and improves healing. After surgery, patients are monitored in a controlled recovery environment before being discharged home with detailed instructions. We provide clear guidelines on movement, medications, wound care, and warning signs to watch for. Follow-up appointments are scheduled to closely monitor healing. Safety does not end in the operating room. It continues through the entire recovery process. If you're considering surgery, choose a qualified, experienced surgeon and an accredited facility. Your safety should always be the first priority.